case, it is rough, especially when you're on the downhill part of it. It's very worrying because, you know, we've all seen how serious it can get. I had a couple of days when it was really very unpleasant, and I've lost about half a stone. But thankfully, I've then recovered, and I'm now feeling fine, and it's very good to be back at work. And I've talked to the Prime Minister all the way through this. He's working very hard as much as he can from home, obviously, in Downing Street. But I've worked with him every day all the way through, and he's doing what's needed and taking the decisions. But we all wish him a very speedy recovery. Well, we've hit the targets that we set at the start in terms of testing, but we clearly need to ramp up the amount of testing. So yesterday I set the goal of 100,000 tests a day by the end of this month. And we have a plan with 5 pillars to deliver on those. In the first instance, the tests that are being done by Public Health England and within the NHS, those tests, which are the bulk of the tests at the moment, they need to expand. But more than that, we need to bring companies, private organisations, the universities, all to bring their testing capabilities to bear on this. You know, Britain didn't go into this crisis with a big testing industry, a big diagnostics industry. But we have got a world-beating pharmaceutical industry, companies like AstraZeneca, GlaxoSmithKline. And so they're going to turn some of their industrial might to this question of testing, and we're going to be working with the existing testing companies to really ramp up their efforts. It's a big task, it's a big ask, but you know, we're opening the NHS Nightingale today. We managed to build that in 9 days. On ventilators, we asked companies that haven't ever made a ventilator before to step up to the plate, and they're delivering ventilators, and now we need to do the same on testing. The testing for frontline staff is a really important part of what we need testing for. As of yesterday morning, 5,000 frontline staff had been tested. The number of doctors who are off is 5.7%. So it's just, you know, we want to get that number down, but it's much smaller than some of the numbers that have been bandied about. And in the main, the vast majority of people in the NHS are doing their duty and going into work. And, you know, speaking directly to them, I know how hard this is within the NHS. And I think they've done an absolutely amazing job of stepping up to the plate and doing their duty. And the vocation to care for people, I think, is just incredibly inspiring to us all.